Welcome to this tape on the treatment of anxiety and related disorders. Anxiety is probably the most common problem you as a counselor will be confronted with. It is pervasive, it is widespread, affects all ages, and because of the stress levels we're under in this world of ours, it's getting more and more common. Christians in particular have difficulty with the problem of anxiety. The reason is, of course, that Scripture has some very clear things to say about anxiety. Paul, for example, in Philippians 4 verse 6 says, "Do not be anxious about anything." And so Christians often feel guilty, they feel judged, they feel bad if they find themselves with any sort of anxiety feelings. So right at the outset, let me just say that when Scripture talks about anxiety, it isn't necessarily talking about the sort of anxiety problems that we will be addressing today. In fact, I have made this statement many times, many of the anxiety disorders that we experience today probably did not exist in New Testament times for one very simple reason, that the pace of life was much slower. We were designed for camel travel, and all of us trying to behave like supersonic jets. But New Testament times, the pace of life was the sort of pace that a camel would set for you whenever you traveled. And that makes a very, very big difference. You will see as we get into the topic of the treatment of anxiety and its related disorders, how crucial it is to be able to help people deal with the stress in their lives. Now, right at the outset, I need to clarify for you what the role of medication is in the treatment of anxiety disorders. It is true, it does play a significant role, and there are times when it is necessary to convince a client, someone you're counseling, that they need to get some help through medication for their problem. But let's clarify what the role of medication is in all of this. Just 2 weeks ago, I sat in a continuing education class that I was taking to update my expertise in psychopharmacology. And the professor who was teaching the class made a statement that I think would be helpful to set the stage for what we're going to be talking about in this tape. He made the statement. He said, "The role of drugs in the treatment of the anxiety disorders remains a minor one." Now, this is a professor of psychopharmacology and psychiatry at a very, very prestigious university, and he says that the treatment of anxiety disorders with drugs is a minor one. The primary treatment modalities remain in the domain of the psychotherapies. To put it in a nutshell, that while depression and some other disorders are more dependent on medication for their treatment, in the anxiety disorders, it's good old-fashioned counseling that is the most important modality there is. But counselors need to know how to relate to other professionals, need to know how to relate to physicians, psychiatrists, because often their help will be needed in the more serious types of anxiety problems. What is the current status of treatment using medication? Well, let me summarize it for you. Presently, in the treatment of anxiety disorders with medication, panic disorder is considered to be excellent. In other words, the best and most appropriate time for medication is probably in the panic anxiety types of problems. So for panic anxiety, it's excellent. For generalized anxiety, and we'll talk about how these forms of anxiety differ in a moment, but for generalized anxiety, medication is only rated as good. has a little benefit, but not a lot. For OCD, or obsessive compulsive disorders, it's considered to be very poor, very poor. So anyone suffering from obsessive compulsive disorders has to depend more on good counseling to help them get over that problem. And at the bottom of the ladder, rated to be ineffective, that medication is ineffective in the treatment of all phobias, including agoraphobia, worry, and anxiety problems like that. Now, anxiety is a problem for our day and age. It is a common experience. Everyone experiences some anxiety. In fact, it is the absence of anxiety that often will get you the diagnosis of psychopath or antisocial or character disorder, because the absence of anxiety makes you a dangerous person to be around. So everyone suffers from some anxiety. I think it's important for us to understand what anxiety's function is in the body. Its primary purpose is to serve as a warning system. It's like the smoke alarm, built into us, designed into us by God to alert us to some potential threat or harm or danger, and then to mobilize us in order to deal with and prepare to deal with that threat or danger. So its purpose is necessary, it's functional, it is there for a reason. Unfortunately, that system in our day and age, because of the increased level of stress, that system is no longer functioning very well. It's like a smoke alarm that is too sensitive. I have such a smoke alarm in my kitchen. And I just yesterday had something in the oven because I like to cook. And I just opened the oven door and that smoke alarm went crazy. I had to go disconnect it because it was too sensitive. And that's the problem with anxiety in our day and age, that the system that is normal and healthy, something has gone wrong. And it is overreacting to sometimes not even any valid threat. But anxiety is also a very common symptom of many, many medical disorders, psychiatric disorders. So as a counselor, you need to know what else can cause severe anxiety and make sure that those aspects of a person's needs can be addressed as well. Bottom line is that if you counsel with anybody with an anxiety problem, and the more serious the anxiety problem, the more important it is that that person get an accurate diagnosis. Because with accurate diagnosis, you have a better chance of treating the disorder successfully. Now, what are the categories of anxiety disorders that we need to be aware of as counselors? Many of you probably in your training have covered the standard list of anxiety disorders as it appears in the Diagnostic and Statistical Manual of the American Psychiatric Association. That's the Bible for mental health workers, telling us the categories of diagnosis and of illness that exists today. Unfortunately, that document, abbreviated DSM, we call it DSM-4 now because it's the 4th edition, unfortunately, it doesn't go very far. It's more a document for insurance claims, so you can put a label on somebody when you want to get paid for treating that person. What is more important for us as we look at the problem of anxiety is to think of categories that have tied into the etiology of the disorder. In other words, what causes it? It's what causes the disorder that requires us to think about the treatment for it, not what its symptoms are. And unfortunately, DSM-4 deals mainly with the symptoms. So what I'm going to do for you now is to go through the categories of anxiety disorder by etiology. Some of them might agree with the standard DSM-4 categories, but some of them are not even listed there, but are still anxiety problems that you and I as counselors have to deal with every day of our lives. So the forms of anxiety by etiology now. Let me go through them briefly with you. The first one, and I'm putting it at the top of the list because it is the most common one, is the problem of worry anxiety. Worry anxiety. Now, worry anxiety is interesting because it did exist in New Testament times. In fact, I am pretty convinced that when Jesus in the Sermon on the Mount told us not to worry about things, when Paul in Philippians 4:6 tells us not to be anxious about anything, in both cases, both when Jesus was talking about it and when the Apostle Paul was talking about it, he was referring to the problem of worry anxiety. Because if you're human, you are prone to worry. And that is a special form of anxiety. It's not even listed in the diagnostic manual. But as a counselor, you're probably going to have more people with worry problems that need to be helped. And so I want to give you, a little later in this tape, some guidance in how to deal with worry anxiety. It's really a bad habit of the mind. And it's a habit that becomes entrenched. And it's a habit that medication will not help you at all with. The next form of anxiety that we have to deal with in terms of etiology is called fear anxiety. Now, what's the difference between worry anxiety and fear anxiety? In the case of worry anxiety, you really are focusing on something that is not likely to happen. You know, there's people, we joke about it, but people will often say, well, if I worry about it, then it never happens. Well, of course it doesn't happen, because you usually worry about things that don't happen anyway. But fear anxiety is somewhat different, because in fear anxiety, there's usually some justification for your anxiety. If you find a lump in your breast, if you find something wrong somewhere in your body, if you're starting to faint, well, obviously you're going to be anxious, because that might just be the beginning of a serious medical condition. So fear anxiety is different from worry anxiety in that in fear anxiety you have some justification for feeling anxious. Now, for me, what is interesting is that God has designed us to deal with fear anxiety. What we are not able to deal with is worry anxiety. And one of the techniques that I will mention later in dealing with worry anxiety is to test the reality of what you're worrying about and either convert it to fear anxiety or dump it and get rid of it. The third form of anxiety by etiology is panic anxiety, or as it's called, panic anxiety disorder. Sometimes, however, long before it becomes a disorder, because for it to be a disorder, it's got to be sort of entrenched and persistent, but long before it becomes a disorder, one can have panic anxiety attacks. In fact, many of the patients I have seen through the years have probably only had 1 or 2 or 3 panic attacks. I usually try to get them to see the positive side, the good side of that, because, you know, to have only 1 or 2 or 3 panic attacks is a wonderful gift. It's your smoke alarm sounding a warning, and if you pay attention to it and deal with the stress that is causing it, you have been saved a lot of pain in your life. So it's usually a good thing, I think, to know where that boundary is, and a panic attack or 2 helps you discover just how close you are to the edge. The more serious form of it, panic anxiety disorder, will need some collaborative help. We have to be thinking a team approach. And so counselors need to be a part of the team, usually includes a physician, maybe even a psychiatrist. Sometimes you've even got to go and get an endocrinologist involved in the problem, because a severe panic anxiety disorder is now the #1 mental health problem for women in the United States. And for men, it is #2. For men, the #1 problem is substance abuse. And I often wonder just how many men are drinking or abusing drugs simply as their way of dealing with their anxiety problems. The fourth type of problem by etiology are called phobias. Now, a phobia is different to a fear. I might fear snakes, but if you put that snake in a cage, a nice thick glass wall between us, and lock the door so that snake can't get out, I could go up to the cage and say to the snake, I'm not afraid of you. You're locked away now. It's okay. But a phobia is a reaction to something like that. Even if it's in a cage with a glass wall, someone with a phobia for snakes will pass out, literally pass out. They could not tolerate getting up close to the snake. And a phobia, therefore, is fear gone wrong. Something irrational has come into being. And about 50% of people today suffer from some sort of phobia. That's 1 in 2 of us has a phobia of some sort. So later in the tape, we'll talk about how we can help people with phobias, as well as with fear anxiety. Then there is another disorder called generalized anxiety disorder. Now, whenever something is called generalized, you know they really don't know what it's all about. But this is a form of anxiety that starts very early in life, where a person is anxious about everything, lives in a constant state of anxiety, vague, and it's very, very chronic, and can be a very debilitating disorder. And we need to know something about how we can help those people. And then lastly, there's a form of anxiety called separation anxiety, which is an anxiety to do with whenever you are separated from your home, from loved ones, from a place that is secure, you experience a high level of anxiety. So each of these I would like to address briefly with respect to how we treat them, what we should do, should we refer them, should there be medication to add it to that form of treatment, try to give you a good overview and a good feel for these very, very common disorders that people suffer from today. Now, I need to take a moment to address the issue of stress, because stress is the primary aggravating factor in our lives today. The pace of life has increased significantly. Why, even the last 4 or 5 years, with the advent of the internet, I think the pace of our life has increased dramatically even more. Adding email wasn't a good idea, I don't think. When I got letters in the mail, it would take a week or 2 for a letter to come to me from, say, Australia. And if I took another 2 or 3 weeks to respond to that letter, they wouldn't be bothered. They know that mail is slow. But now with emails, if an email comes in the morning and I haven't responded by the afternoon, I'm getting people, getting angry at me. Why haven't you responded to my email? And so this has put up the pace of my life, and probably your life as well, and the lives of those that you have to counsel. And so the pace of life is accelerating at an enormous rate. And now that is the context in which you have to understand the stress problem. Most of us can do nothing about it. We can't retire and live in a quiet island in the South Pacific somewhere and get rid of everything that bothers us. Where can you go to resign from this world? It's one of those things. It is inevitable. We have to stick with it. But it is important to understand that no matter how stressful your life, you can find a measure of peace and tranquility. After all, Philippians 4:6 goes on to say, and the peace of God, which passeth all understanding, will keep your hearts and minds in Christ Jesus. And what we have to do as counselors is point people towards that tranquility and to help them by whatever means we can achieve that appropriate level of tranquility. Now, because of this tremendous amount of stress we are under today, we differentiate anxiety into two categories. And I think this can be very helpful for you as a counselor to think of all anxiety disorders as fitting into one of two categories. The first category is a category we can call endogenous, meaning that it's from within, meaning that it is essentially biological. Endogenous anxiety, on the one hand, as opposed to the other category that we could call reactive or situational anxiety. Let me illustrate these two categories for you. The endogenous or biological anxieties include, for example, panic anxiety disorder. It includes probably the generalized anxiety disorder and even some of the OCD, the obsessive compulsive disorder as well. These anxiety disorders are the product of the increased stress in our lives. We just don't know how to manage our bodies and our minds in such a way as to live within the limits that God has designed for the human body. We are abusing God's creation. That's the point I want to make. And the penalty for that are these anxiety disorders that we call endogenous. Now, reactive anxiety disorders are different in that, as the name implies, they are reactive to our environment. Worry anxiety would be a reactive form of anxiety. Phobias are reactive. They are caused by situations and therefore are less likely to be biological. And this distinction is important because if it's less biological, namely reactive, then medications are going to be less effective. Going to be probably not of no value whatsoever. So we only consider getting medication help for those anxieties that fit the endogenous category. Now, since this is an advanced tape, I need to say a word or two about the biology involved in these anxiety disorders. So bear with me while I make a few comments about that. Stress is over-arousal of our adrenal system. Anything that gets our adrenaline going, good or bad, is stress. That's important to understand. But stress releases from the adrenal glands above the kidneys a whole host of hormones. A hormone is simply a messenger. That's all a hormone is. It's a messenger that carries a message to parts of the body. And the hormones from the adrenal glands do their damage by targeting certain areas of the brain. For example, cortisol, which is one of the major hormones from the adrenal glands, targets a part of the brain and blocks a receptor for something called GABA. The effect of that is to block natural tranquilizers that are in the brain from getting to their receptor sites and locking into those sites and keeping us peaceful and calm. So we now know that excessive amounts of cortisol produced by stress is a major factor in causing these endogenous anxiety disorders. Which is why just giving a tranquilizer isn't good enough. It can help a little bit in these disorders, but it doesn't cure the disorder. The cure lies in getting the cortisol out of those receptor sites, lowering our stress, lowering our cortisol levels, and getting back to a lifestyle, a pace of life that is below the threshold for causing this sort of problem. So we'll come back later to stress the importance of good stress management. Chronic stress also depletes the natural tranquilizers in other ways. It also has an impact on our immune systems, which is why we see so many other physical conditions going along with anxiety disorders as well. And because stress is so damaging to the brain's natural tranquilizer system, I think every counselor should know how to mobilize natural tranquilizers, how to restore natural tranquilizers, how to increase the natural tranquilizers that, after all, they are in your brain. They don't cost anything. They're designed there to be there by God. And if you only know how to manage that system a little better, you can help people become less anxious. Now, because there are many physical conditions associated with anxiety, the counselor should be aware of them so that you can see that whether or not they are connected in any way to the problem that someone is experiencing with anxiety. Just yesterday in USA Today, there was a report that provided some interesting information about the ailments, the physical ailments that are correlated with anxiety problems. This I thought might be helpful for you. First of all, acid reflux. You know, that's when the acid comes up from the stomach and burns the tube, the esophagus, and sometimes goes right into your throat. Acid reflux. 12% of normals suffer from acid reflux, but anxiety sufferers, the percentage is 30%. 1 in 3 with anxiety suffers from acid reflux. Allergies, normals only 11%. Those with anxiety, 27%. Backache, 12% for normal people. 26% for those who suffer from anxiety. Asthma, only 6% of normals, but 16% of people with anxiety. Fatigue, only 2% of normals suffer from fatigue syndromes, but anxiety goes up to 15%. Migraines, for normals, 4%, but for people who are anxious, it's 12%. Now, all this is to say that all anxious people must have a thorough medical evaluation before you proceed any further with your counseling. This is necessary to ensure that no medical condition is being overlooked as the possible cause for that person's anxiety. In particular, you need to look at the thyroid gland and need to look at issues such as hypoglycemia. But the physician will know what sort of problems to look for. Not only must you rule out medical conditions when dealing with anxiety problems, but you must also rule out substances that can cause anxiety. Now, I know I'm going to be tramping on some people's toes here, but what else can I do? The top of the list for me of substances that must be ruled out as possible causes of anxiety, of course, is caffeine. Caffeine. We consume a lot of caffeine in our culture. Caffeine is a powerful drug. It is a stimulant drug. Not only does it stimulate adrenaline and therefore push up the cortisol levels, but it also goes to the brain and targets certain receptors in the brain that control sleep. So anyone who is drinking a lot of coffee, taking in a lot of caffeine, by no matter what source it is, will be experiencing anxiety problems, and that needs to be identified and eliminated if necessary. Alcohol abuse, inhalants, some of the illegal drugs, cannabis, cocaine, etc., can all contribute to anxiety problems. And let's not forget that anyone who suffers from asthma, taking asthma-type medications, may also experience anxiety problems. Now let's turn to some specific anxiety disorders, and let me share with you some of the treatment modalities that can be used for them. The top of the list, of course, is panic anxiety disorder, because it is the most serious of all. It is an endogenous form of anxiety. In other words, it is biologically based. Panic anxiety disorder is not in the head in the sense that it's in your mind, nothing you are imagining. It has a very, very clear and definite biological basis for it. And there are really two types of panic anxiety disorder that you need to be aware of. The first type of panic anxiety disorder comes about through hyperventilation. In other words, the person who experiences the panic starts to hyperventilate, is breathing deeper, is taking in more oxygen, and that becomes the trigger for the panic attack. That's the one type. Another type is triggered by exercise, physical exertion. Pushes up the sodium lactate level in the bloodstream, and this provokes a panic attack. Now, the treatment doesn't really matter which of those two causes it. However, when someone reports that whenever they do something physical, such as mow the lawn or work out, go for a long walk, they begin to experience panic attacks, then they have the exercise-sensitive panic disorder, and they need to be encouraged to lower their level of exercise, at least until the disorder is brought under control. Now, the symptoms of panic disorder, there are physical symptoms, first of all. Physically, they are hyperventilating, and the way they experience the hyperventilation is they say that they can't get enough oxygen, they can't get enough air. So I've got to get to a window. They sit on the edge of the aisle in church so that they can be near a door. They become so afraid that they're not going to get enough oxygen. Now, the paradox is that they are taking in too much oxygen. That's the problem. And so that sensation of air hunger is a powerful symptom, but is also a very frightening thing for them. They also feel dizzy. They want to faint. There's a pain around the chest. It's as if someone is wrapping a steel band around their chest and tightening it. This is why many people, the first time they have a panic attack, think they're having a heart attack. And so they rush off to the emergency room in order to have that attended to, and then discover that, in fact, what they're having is a panic attack. But that is the level of discomfort. It's so frightening for them. There is also, in a panic attack, a fear of impending doom. That's the best description I can make up for it. A fear of impending doom. A fear that something terrible is about to happen. And that fear associated with these other symptoms are the sorts of symptoms that go along with panic anxiety attacks. Now, the attack itself usually doesn't last longer than about 10 minutes. So the treatment, therefore, has to be carefully designed to do two things. First of all, to stop the panic attacks from happening, and then secondly, to prevent the panic attacks in the future. So one has to think in terms of both of those. Since the attack lasts only about 10 minutes, there's really not much point in them taking a tranquilizer because by the time the tranquilizer kicks in, the attack is going to be over. So the treatment strategy is usually this. If you as a counselor are encountering someone who's having panic attacks, then you need to get a physician's involvement in the treatment, because there is a short-term phase to the treatment and a long-term phase. The short-term phase is to get treatment in place that will stop the panic attacks. By every means possible, you have to stop the panic attacks. Each panic attack that the person suffers raises their fear level of such an attack. We call it the fear of fear. And each time they have a panic attack, their tendency to develop panic attacks actually goes up. So we have to stop these attacks, and this is why medication is not optional, in my opinion, but absolutely necessary for someone suffering from panic attacks. The medication, to begin with, is usually a tranquilizer called Xanax, together with a beta blocker or an adrenaline blocker, which can be very helpful in lowering the stress level. And that is the immediate, for the first month or two, is the treatment that has got to be in place. However, a panic attack sufferer cannot live the rest of their life on such medication. The tranquilizer is an addicting type of medication, so you want to limit the duration in which a person takes these medications. So there's a second strategy for the long-term treatment of the panic attack that must be put in place and started at the same time as the Xanax, the tranquilizer, and possibly the beta blocker to block the adrenaline. These are started simultaneously. And the reason for starting them simultaneously is that the second medication is actually the same medication used in depression. It's an antidepressant, and it's usually one of the SSRIs, the serotonin reuptake inhibitors, SSRIs. Prozac is the classic or the gold standard for the SSRIs, but is by no means the only one of those medications that can help to treat panic anxiety attacks. So the long-term treatment then is to start the SSRIs simultaneously with the other, to let the tranquilizer last for 6 weeks, 2 months, make sure all the panic attacks have stopped, and then that medication can be withdrawn, but the patient continues to receive the SSRI for a period of time. The SSRIs can take up to 2 months before they kick in and have any effect. Now, from a counseling perspective, while these treatment with medication, these treatments are necessary and very helpful, in the long term, one has got to address the stress issue. And therefore, no one should be on these medications who is not also getting counseling. And the counseling approach has to be targeted on stress management and life change issues. Stress management and lifetime issues. I've treated, for example, several big-time attorneys. And for them, life can be pretty hectic. But I had to address not only the stress in their lives, in other words, to force them to take a break in the mid-morning, to take a proper lunch break and not to make it a working break, to take a break in the afternoon, and then to do some of the other things we'll talk about in a little while. But I also addressed certain lifestyle issues. Traveling, commuting down to downtown Los Angeles in a heavy traffic freeway system doesn't contribute to your healthy state of mind. And so some of them have actually had to change their lifestyle, changed where they lived in order to find an easier way for them to get to work. Now that we're beginning to get a commuter system going in Los Angeles, to live near a commuter train to get them to work. So a counselor has to address stress management issues as well as lifestyle issues. I'll come back in a moment and talk about some general strategies for stress management. Let's move to a second serious form of anxiety disorder and talk for a moment about obsessive-compulsive disorder. It's a strange disorder in that we call it obsessive-compulsive, meaning that there are obsessions and there are compulsions. Because in about 85% of cases, the patient has both obsessions and compulsions. About 2.5% of the population has such a disorder. It is a chronic disorder. It waxes and wanes. It comes and goes. And in 50% of the cases, there is also major depression. So more likely than not, if you see someone with OCD, you're also seeing someone with a serious depression problem. Now, the treatment of OCD with medication has a marginal benefit. The research that has been done shows that while you can bring the obsessions and compulsions under control with medication, the moment you stop the medication, the disorder comes back again. So therefore, the treatment has to include good counseling. And the counseling is addressed towards dealing with both the obsessions and the compulsions. Now, the obsessions, as you probably know, have to do with the persistent, intrusive thoughts and impulses that they have. It is the thought process that becomes obsessive. They can't get it out of their mind. They can't stop thinking about something that just goes round and round and round in their mind, and there's no way they can get rid of it. The compulsions are the behaviors, repetitive behaviors. Sometimes it's, you can recognize such a person because when they walk down the footpath, they are very careful not to tramp on any cracks. Some of the compulsions have to do with the desire to check up on things. My mother suffered from compulsions rather seriously. She could never leave the house without having to go back and check that the stove had been turned off. And she would go back and check it and then lock the front door, and as we were walking down the driveway, she would turn around and says, I must go and check the stove again. And we would all get mad at her, but she had to go back and check the stove again. So they have these compulsive, repetitive behaviors because they can never, ever feel at peace that the thing that they should have done has been done. This is why OCD is considered to be an anxiety disorder, because the obsessions and the compulsions essentially are designed to reduce the anxious feelings. There's a buildup of tension. The further you walk away from the stove, the higher the tension. And the only way you can relieve that tension is to go back and touch the knob on the stove and make sure that it is turned off. It's a disorder, therefore, that is not pleasurable at all. It's erroneous to think of some addictions as obsessions and compulsions, because in addictions, the behavior is actually pleasurable. But in true obsessive-compulsive disorder, it is not pleasurable. It is extremely painful. Now, the best treatment for obsessions and compulsions is behavior therapy. A therapy where you set up certain reinforcements for the right sort of behaviors. It's not the sort of treatment that one can engage in without proper training. So usually it requires that you refer the person with such a disorder to a psychologist who is experienced in behavior therapy and who can do the sort of training that is necessary to reduce the obsessions and the compulsions. Now, if medication has to be used, then there are several medications that can be helpful. And again, it's usually one of the antidepressants that helps. Because somehow there is a connection between these disorders and the depression disorder, and so the same medication is able to help both of them. The third disorder that I'd like to draw your attention to is the generalized anxiety disorder, sometimes called GAD, G-A-D. This is a long-term, continuous form of anxiety. These people are chronic worriers. It's the what-if syndrome. It is, what if this, what if that? They are always anxious about everything. They don't know whether they should, they have difficulty making decisions. So it's a chronic disorder, and unfortunately medication is not helpful at all. And again, it is mainly cognitive behavior therapy that is the most effective in treating this disorder. Phobias, another major category, fall into two types: a social phobia and specific phobias. Let's talk about each of these. Social phobia is usually someone who has a fear of being scrutinized or evaluated. They think that people are watching them all the time. I recall a patient who came to see me. She was only 19 years of age. And when she walked down the street, she was absolutely convinced that every single other person on the busy street was turning to look at her, to observe her. And not only were they observing her, but they could actually read her mind as well. And of course, it can be a very debilitating disorder. You don't want to go anywhere. You want to stay home. You want to avoid contact with other people. Very often, people with this disorder will turn to self-medicating, and they will become alcoholics. They will abuse drugs, anything that can numb their feeling of discomfort. Specific phobias are phobias of snakes, phobias of high places, phobias of closed spaces. And unlike social phobias, which needs long-term cognitive behavior therapy, phobias can respond quite readily to less intensive types of therapy. Specific phobias, such as a fear of flying, can usually be treated through a technique called systematic desensitization. In this technique, you begin usually by having a patient, in their imagination, imagine the object that they fear. For example, let's suppose they fear snakes. Well, you have them relax, you teach them a relaxation technique, and they imagine that there's a snake a mile away. They can hardly see. It's like a speck on the horizon. The anxiety first goes up, you then have them relax, and the anxiety goes down. And then in their imagination, you move the snake to a half a mile away. And as the anxiety goes up, they learn to relax in the presence of that thought. And this is what is called systematic desensitization, the gradual exposure of the client to the phobia. And if you do it extremely slowly, it works well. Unfortunately, some therapists tend to push the procedure too fast and therefore often make it worse. And so there is some risk here that if you don't do it properly, if it's not done by an experienced therapist, that you will make the phobia worse. But it is a very, very effective way of treating phobias. Well, I want to come back now to the worry anxiety, because I think this is the one where counselors can be the most helpful. This is a problem that Christians suffer from as much as non-Christians. And I think that ultimately worry is an issue of faith. That's what Jesus said. You know, I have told you, I go to prepare a place for you. So don't worry, I will take care of it. Now, everybody worries a little. I worry occasionally. I'm glad to say that as I've gotten older, I tend to worry less than I did some years ago. But the worry needs to be understood as a warning system that has gone wrong, and there are several ways you can help someone to deal with that worry. In fact, there are 3 E's that I would like to share with you, 3 E's that can be very, very helpful. The first thing to do with worry anxiety is to embrace it. What reinforces anxiety, worry anxiety, is the tendency to want to run away from it. So I encourage clients who worry a lot to carry a little notebook around with them, and every time they worry about something, welcome it. Say, okay, come here, now I want to make a note about you here in my book, and write down what it is that is worrying them. So you change the attitude to it. You invite the person to come and embrace it, and you write it down into a notebook. And writing it down is very, very important. Then the second thing is you explore it. After a couple of days, when you've started to develop a list of things you're worrying about, now you can begin to explore why it is this thing is worrying you. And you ask yourself the question, what can I do to deal with the thing that is worrying me? This is a way in which you convert the worry into concern. In other words, if you are concerned about something, that's a healthy thing. If you worry about something, that's not very healthy. If you have a lump somewhere in your body that you think might mean there's something wrong with you, if you do nothing about it, you're going to worry about it. But if you decide that there is something I can do about it, then I will take some action. It becomes concern, and when it becomes concern, it is a healthy thing. And the third thing to do then is to extinguish your worry. We know that from some very interesting research that if we worry about something for less than 3 minutes or more than 15 minutes, we can extinguish it. It stops coming. So you either have to catch it and don't worry about it for more than 3 minutes, or, and that's almost impossible, if it goes beyond 3 minutes, then you've got to keep that worry going for at least 15 minutes. And one way you can do that is, again, write down in your little notebook what it is that was worrying you, and then set aside a time, maybe later that day or in the early evening, when you will sit and worry about that thing that's bothering you, and you will worry about it. Set a kitchen timer for 15 minutes, and you sit down and you determine to sit and worry about that which is on your mind. Now, I was explaining this once in a seminar, and a lady raised her hand and said, but if I did that, my mind would go somewhere else. And I said, yes, well, that's exactly the point. If you try to force yourself to worry about something for 15 minutes, interesting thing happens. Your mind goes somewhere else. There are some important thought habits that need to be addressed. I've written a book about that called Habits of the Mind. And so as a counselor, there are ways in which you can help people address their thinking patterns, because worry, after all, is a habit of the mind. Now, as I bring this tape to a close, I want to share with you some ways in which you can enhance your brain's natural tranquilizers. I think this is perhaps one of the most neglected strategies that in counseling that I can think of, the most neglected. Enhancing the brain's natural tranquilizers can help the brain to restore itself to a healthy functioning again. So let me give you some important strategies. The first and most important strategy for enhancing your brain's natural tranquilizers is to sleep more. Sleep is crucial. The research, almost by the week, I'm finding new research that supports something that I have preached for 20 years, and that is that we don't sleep enough. Without adequate sleep, the brain cannot restore its natural tranquilizers. So pay attention to sleep, sleeping habits, and help enhance those habits for someone you're counseling with. The second strategy for enhancing natural tranquilizers is to ensure an adequate level of exercise. Here again, the research is clear that exercise is crucial. Exercise is necessary to the brain. You don't just exercise your legs and your arms and your muscles. Exercise does something in the brain as well. It enhances the tranquilizers in the brain and can help you cope with the anxiety in your life. The third enhancer of natural tranquilizers is humor, laughter, or, bottom line, happiness. Unhappy people rob themselves of natural tranquilizers. It's not without reason that Scripture refers to humor as being a medicine, and it is literally that. Another important strategy is to maintain an optimistic outlook. Optimism, a positive outlook, is now being identified as a powerful anti-stress modality. It lowers our stress hormones. It is an antidote for stress. Now, I'm always a little bit concerned about optimism, because I don't know that one can be very optimistic if you don't have a solid faith system. Because in the final analysis, the optimism that you and I as Christian believers hold on to is not an optimism born of no reason, doesn't have any basis. It is born of a hope that comes about knowing that Christ is our Savior, that God is our keeper. And it is that hope that we can build a tranquil life and a tranquil mind about. It is, after all, the basis upon which the peace of God is given to us. So my prayer for all of you who counsel those who suffer from anxiety problems, with all its complexity, with the need for you to be a team player, to cooperate with other professionals who will be a necessary part of that treatment program, that you, particularly as a Christian counselor, will be able to give your counselees a sense of hope, that God, after all, is in control, and that life can be rich and full in Him. God bless you.